Hi, I'm Sarah Buckley. I've been a nurse since 2015. I began my career working with adults in a same-day surgery unit. I shortly transitioned to working in a neonatal intensive care unit. I've had the pleasure of working in both Rhode Island and Massachusetts at union and non-union hospitals. I'm currently enrolled at Regis College and pursuing a degree in my pediatric nurse practitioner. This testimony will examine the Medicare-for-All Act of 2019 proposed by Bernie Sanders. Medicare-for-All Act of 2019 is a national health program that will be governed by the Department of Health and Human Services. Under this act, all U.S. residents will be covered. Individuals upon birth or residency of the United States will be able to apply for Medicare for All. Medicare for All will consist of hospital services, prescription drugs, mental health and substance abuse treatment, dental and vision services, and home and community-based long-term care. Unlike other and past insurance plans, Medicare for All will allow for patients to pick for any participating doctor. This act will provide first dollar coverage without premiums, deductibles, or copays for medical services. Although there can be copays for certain brand name medications, but negotiated prices with drug manufacturers will be able to happen. So why should we support this legislation proposal? President Donald Trump proposed a plan to abolish the Affordable Care Act. If this goes through, health care coverage will be lost by millions of Americans. Nationwide pre-existing protections will end, Medicaid expansion will stop, financial assistance will be cut, and healthcare markets will become destabilized, thus increasing premiums. Millions of Americans will lose their already affordable care, health insurance prices will rise, drug prices will rise, and all increase significantly. Every individual who's a resident of the United States is entitled for benefits of healthcare services under Bernie Sanders' proposed act. With this act, problems will arise. The problems that arise from Trump's proposal to abolish the ACA will be avoided. Everyone covered under this new bill will be paying lower costs and have better benefits. It's going to improve healthcare for not only citizens, but it's going to improve the way the government works. With this act, Medicare for All is making healthcare a human right. Mental health under our current Medicare is limited. Part A Medicare only pays for 190 days of hospitalized inpatient services, including things like meals, nursing care, lab tests, and medications. Part B covers mental health services provided by doctors if you're admitted to the hospital. Under the Medicare for All Act, mental health services and substance abuse treatment will be fully covered. Medicare right now does not say anything about outpatient services for mental health, and they limit a time frame for how long you can be in the hospital. Full coverage with no limits and outpatient services would benefit the communities of the U.S. if the Medicare for All Act is passed. It's in the best interest for legislation to support this bill. Although this bill is written out and there are some suggestions that can be made. Bernie's Act only allows for at-home long-term care, but does not mention anything like institutional programs such as nursing homes. Representative Jay Paul's bill does include such a plan. If Sanders and Jay Paul were able to combine their ideas and propose a new bill, we might be able to create better coverage for all of our citizens. Sanders' plan does include patients to pay a small copay for certain medications. Research has shown that when patients need to pay for medications, they're less likely to take those medications, thus increasing sickness and long-term costs. If all costs for medications could be avoided, patients might be more willing to take their medication, thus creating a better focus in preventative care and hoping to lower costs for more expensive visits like emergency room services. I'd like to thank the members of the Legislative Committee and thank you for listening and taking the time to listen to my testimony on the Medicare for All Act of 2019 proposed by Bernie Sanders. If you have any further questions, please feel free to contact me through my medias. I can be reached at on 774-245-2627. or I will answer via email at sbuc803@regiscollege.edu. Thank you again for your time and attention.